Hi there. If you're watching this video, it is because you ordered a kit from Discovering Wellness, which is a live blood and dry cell analysis kit for blood work. And so I am Dr. Kimberly, and I'm going to show you how to take your blood samples. When you got your kit, it would either look like this little square box, or it would look like this rectangular box. So in the box, you're going to find a instruction form. And this instruction form is a detailed instruction form of how to take your blood work. But once in a while, people have a problem with it and get confused with the slides, and then they come back incorrect. And so that is why we're doing this video, so that you can just go to this and bypass this and see exactly how to do it. So in your kit, you're also going to have a pair of gloves. These gloves are if you need to have someone else poke your finger, they're going to want to wear these gloves. If you want to wear them as well when you poke your finger, that's fine, but you do not have to. Make sure that you wash your hands prior to doing this, obviously, and then you'll also have a alcohol pad that you'll be able to use as well, so you'll be cleaning the finger a little bit more. So in the box, you're also going to have this little white box. This one will come in these square boxes. They will not come in the rectangular boxes. In the rectangular boxes for your cover slides, this houses the cover slides. The cover slides will be in a box like this as well. They will be loosely laid in there and kind of padded in there, so be very careful with them when you open that box. These microscope cover slides are very, very fragile, extremely thin, and they will break if you put too much pressure on them. So when you open them up, this is how I always do it. I open it up and I take it by the edges, just by the edges, so that I'm not smudging anything. You want to make sure that you don't smudge any of the slides with your fingerprints or anything. And so this is going to be the slide that you use to capture your live blood. And then the frosted microscope slides are going to be for your dry layers, and also to seal your live blood between a microscope slide and this cover slide, which I'll show you here in a minute. So in here, you're also going to have, in this other box, you are going to have your frosted slides. So the frosted microscope slides look like this. Again, always hold them by the edge. As far as the frosted slide, if you have a little marker that you want to put your name and date on there, that would be great. If you don't, that's fine. But do make sure that you include your name in the box if it's not already in there. In the box, you're also, if you're a new patient, you're going to have a Discovering Wellness consultation form, which that will automatically have your name in there as well. On this form, there's a disclaimer form on the very back of this as well. So we need your history, but we also need you to make sure that you sign that disclaimer form. If you don't sign it and you mail your blood in, we won't be able to do your blood work. So we do need that form signed as well in order to take the blood, to do the blood sample. And so in this box, you also have your Band-Aid. You have a lancet, which you'll twist off the cap to poke your finger, and then you'll also have an alcohol pad. There's extra so that if needed, you should only have to poke your finger one time, but if you do have to do it twice, there is 2 lancets in there. So those are the contents of the kits, of the blood kits. So now we're going to move on to how to do that. So you are going to take your microscope slide. I always like to set them on an edge, and so I am going to just use the edge of this kit for right now. So you'll set them, usually I use the edge of my microscope, but we're going to set them just a little offset so that you can grab it by the frosted area of the slide. And so when you have that sitting there, you'll have it all set. So we are going to start with the live blood. So the first thing that you will do is take your alcohol pad. You're going to wipe your finger off really good. I always use the little finger. It's just much easier. We don't use it as much. It's out of the way. And so you're going to wipe it really good, clean it up nice. And then we're going to take a tissue and we're going to wipe it off really nicely. You're going to take your lancet, you're going to twist off the top there, got your needle. I like to hold my finger when I'm doing it myself, just kind of press down here and get a little ball right there, and then just gently poke. See, doesn't hurt. Your blood should just come up on its own. Then you're going to take your cover slide, again right by the edge, and when you take that cover slide, you're just going to go straight down on top of that blood sample and grab that so you can see it's on there. And then immediately you're going to put it down on top of one of the cover slides so that that blood is in between the two slides, the cover slide and the frosted glass slide. You do not ever want to press on the blood in the center, but you do want to press around the edges of that. You want to get just the right amount of blood so that we need to make sure that it's enough that we can see it and that it is good, a good sample, but not as much that it's coming out through the edges. We don't want it bleeding off of the edges. So it's going to look basically kind of like that when you're, I don't know if you can see that, but just a nice little sample in there. So that is the live blood, and then I'm going to wipe off my finger here. I don't wipe it off with the alcohol again, just with a tissue. And then you're going to take your next microscope slide as well, another frosted glass. You are going to squeeze that ball back up again. So you can kind of see there that I've got that ball right back up there again. And so when you have that ball up there again, you're going to take, if you're a new patient, we need 8 layers. If you're a follow-up patient, we only need 3, which a lot of you already know that. But to take your 8 layers, we're going to go 1, 2, 3, 4, 5, 6, 7, 8. So we're going to go straight down, 1, 2, 3, 4, 5, 6, 7, 8. That is a perfect sample. So once you do that, you need to flip it over right away. So I delayed a little bit because I was talking, but take those samples and flip them right away so that they don't run or spread or anything like that. Your layers are all going to vary in size, so your 7th and 8th layer are going to be so small that you're going to probably think that nothing can be done with them, but they do show a lot. So again, it's going to look basically like that. 1, 2, 3, 4, 5, 6, 7, 8. And you're going to let that dry. It's going to take probably about 15 to 20 minutes. I always tell people to wait a good half an hour though before you wrap them up. So you're going to wrap them up in tissue. Make sure with your dry layers, because you're doing 2 of those, you don't want them to scratch the blood off of each other and rub up against each other. So wrap them separate in tissue and then place them back in this box along with any extras, things that you may have, you can throw back in this box. But put your live samples in your dry layers in this box, and you do have to return all the boxes. So we need this box back. Don't write your name on them. Write your name on a separate piece of paper, please. We need this box back. We need this box back. Otherwise, there is another $20 fee. So we don't want to incur that. So, okay. That is how you do your blood analysis samples. So you want to make sure that when you send them back in that you call the office at 815-397-7711. Make sure that you have set up a date already to mail them back. They do have to be overnighted. Overnight them through FedEx or UPS. Do not use U.S. Postal Service. Their overnight is not guaranteed for one night. It says right on the label that it could take up to 2 days. So we want to make sure that we only mail through FedEx or UPS. And then again, make sure that you call the girls at the office, that you're set up for the date to mail it back. We get many of them, so we can only accommodate so many on each day. So we do need to have that set in stone as well. And so that is basically it. Not too bad there, huh? So we'll await your blood samples, and we'll get you on the path to wellness. And you take care, be blessed, and be well. Thank you. Bye-bye.